So, good evening, everyone. Today we'll be talking about the next topic. So, the forum of our today's discussion will be about short-term regulation of blood pressure. So, in the earlier class, we have discussed about what do you mean by blood pressure and what are all the basic concepts which is relative and which is applicable to measure the blood pressure, and what are all the causes which can increase and decrease the blood pressure. So today we'll be learning about our next topic, what we call it as short term regulation of blood pressure. So as if the term says, that short term regulation means the blood pressure is usually controlled by a short term method. Means if there is an increase in or decrease in blood pressure, there will be like a regulation of the blood pressure for a short period of time, which you may take around 2 hours to 3 hours, or either it may also ranges about for minutes. So let us talk about that. So before we get started with the main topic, we will be discussing about the nervous system which helps in regulation of blood pressure. So let me write it down over here. Nervous system. So as you are aware of the fact that the nervous system plays a huge role in regulation of blood pressure. So which part of our nervous system helps in regulation of blood pressure? So usually nervous system has got two types. One is CNS, what you call it as central nervous system, and another one is ANS. So CNS usually consists of brain and spinal cord. You're all known with the fact that CNS comprises of brain and spinal cord. And what about the ANS system? As I have discussed in the previous lecture, ANS consists of two types. One is sympathetic and another one is parasympathetic. So these are the two systems which helps in regulation of blood pressure. So what does the sympathetic system does with the blood pressure, and what is the impact of parasympathetic system in regulation of blood pressure? So usually sympathetic system regulates the blood pressure by increasing and parasympathetic system regulates the blood pressure by decreasing. So if there is any case of hypertension, as you're all known that hypertension means increase in blood pressure. So if there is any increase in blood pressure, then how does the blood pressure gets down to the normal level? It is usually the responsibility of that action is usually taken by parasympathetic system. And if there is a case of hypotension, if a patient is suffering from hypotension, then the increasing of the pressure to the normal level is usually the responsibility of that action is usually taken by sympathetic system. Okay, so now like which are all the nerves, like which are all the nervous system from which part of our body the nervous system is responsible for controlling these all the aspects. So as you know that the vasomotor nerves, which are responsible for increasing and decreasing blood pressure, and vasomotor nerves are gets innervated to the blood vessels of our body. So where does this vasomotor nerves arises in which part of our body does it arises? So usually vasomotor nerves arises from our from our thoracic to first or second lumbar spines. Thoracic and first or second lumbar spine. As you're all known about the vertebral column. So what is the division of vertebral column? There are eight cervical spines, 12 thoracic spines, 5 lumbar spines, and C1 to what we call it as coccygeal. C1 3 coccygeal spine. Okay, these are all the divisions of our vertebral column. So usually the vasomotor nerves arises from thoracic and lumbar, from first and second lumbar part. Okay. Again we divide this innervation, like usually vasomotor nerves innervate the blood vessels. So again, how do we divide the vasomotor nerves according to the innervation of which part of our body? So usually it is again divided into two parts. One is internal viscera and heart. So you might be knowing the internal viscera, the internal organs which are present in our chest and in our abdomen. So the vasomotor nerves which innervates internal viscera and heart comes into this part. And another thing is peripheral areas. Peripheral areas in the sense, apart from the main internal organs where the vasomotor nerves arises, there are some peripheral areas such as our thigh, leg, or even our foot or our forearm and hand. So these are all the peripheral areas where the vasomotor nerves arises. Okay, hope you might have got this point. So let us go to the next topic, what we call it as sympathetic innervation of blood vessels. Sympathetic innervation of the blood vessels. Okay, I hope you might have got the previous part where I have discussed about the basic things which has to be which has got to be the basic part of all the things. So if we talk about the sympathetic innervation of the blood vessels in most of the tissues except the capillaries are innervated. Means like most of our blood vessels which supply our tissues are innervated by sympathetic nervous system. So let me mention that point. Most of the blood vessels I'm sorry, let me correct down the sentence. So most of the tissues, I got I got puzzled with that point. Most of the tissues in our body are innervated by the sympathetic nervous system. And there is an exception which should be discussed, that all capillaries are innervated by only parasympathetic system. Innervated by the parasympathetic system. Okay. As I have said, like most of the tissues in the body, in our body, are more, and the blood vessels which are passing to these tissues are innervated by sympathetic nervous system, which helps in usually, which is responsible for increase in blood pressure. So, and the exception which comes under is capillaries, which are present in our peripheral areas of our body, are innervated by parasympathetic system, which is responsible for decrease in blood pressure. Now, like coming up to the next point, the precapillary sphincters and the meta-arterioles are innervated in some tissues, such as the mesenteric blood vessels. So let me mention that point here. Precapillary sphincters and meta-arterioles. So what do you mean by meta-arteriole? As you might have studied about the blood vessel branches. So usually you have got two types. One is artery and another one is vein. So again there is a division of arteries and veins. Again, artery is divided into arteriole and vein is divided into venule. So the connection between the two capillaries is controlled by the meta-arteriole. So this is the blood vessel in our body which connects the two capillaries. So usually it is also responsible for anastomosis. Anastomosis, in the sense the communication between two blood capillaries, is called as anastomosis. So we can also say that meta-arteriole is also responsible for anastomosis, are innervated by in some tissues such as the mesenteric blood vessels. So what do you mean by mesenteric blood vessels? So usually the arteries and the veins which are present in our abdomen, or like what we see in intestines, intestines is called as mesenteric blood vessel. It is usually found in intestines or in the, usually intestine is present below the abdomen, around the abdomen. We can also mention it over here. It is usually found in the intestines or in the abdomen. Okay, so what do you mean by the precapillary sphincters? So the precapillary sphincter, in the sense, it is a kind of opening in the capillary which helps in regulation of blood flow to the capillaries. Like it is a kind of oval shaped structure which is present in the insiding part of the capillary and exiting out of the capillary. So these are called as precapillary sphincters. Usually as we take these all the things, precapillary sphincters and meta-arterioles are innervated in some tissues such as the blood vessels. So we can see the parasympathetic innervation of the blood vessels in mesenteric blood vessels, in which part the parts are precapillary sphincters and the meta-arteriole. Okay, and the mesenteric blood vessels, in the sense the arteries and the veins which are present in the intestines are called as mesenteric blood vessels. Okay, now coming up to the next point, the innervation of the small arteries of and arterioles allows sympathetic stimulation to increase the resistance to blood flow and thereby decreases the rate of blood flow through the tissues. So let me mention that point, and I'm gonna explain after mentioning, so that you can take these points as kind of notes or anything. The innervation of the blood vessel, such as small arteries and arterioles, allows sympathetic stimulation to increase resistance to blood flow and thereby decrease the rate of blood flow to the tissues. So what does this point mention? As I have said, the innervation of the blood vessels, such as small arteries or arterioles, as I have said, the arterioles are the small branches of the arteries. The innervation of the arteries and arterioles by the sympathetic stimulation increases the resistance. Means if there is flow of blood to the arteries and to the arterioles, then there will be a sympathetic stimulation to the walls of arteries and arterioles, where it increases the resistance of blood flow. Means if there is an increasing of resistance to the blood flow, we will see a kind of flow what we call it as turbulent. Usually there are two kinds of blood flow. One is streamline and turbulent. If there is a severe case of turbulent flow, then it is usually seen in patients who are suffering from diseases such as atherosclerosis, or a person who has a previous history of cardiac arrest or myocardial infarction, or what you call it as heart attack. The blood flow, so as I said, if there is an increase in resistance to the blood flow become turbulent. Okay, and this will lead to the decrease of the rate of blood flow to the tissues. So what happens when there is a decrease of rate of blood flow to the tissues? If there is decrease of rate of blood flow to the tissues, there will be less rate of metabolism seen. And there will be huge amount of oxygen demand. So it's a kind of common sense thing, like if there is a decrease of blood flow to the tissues, then there will be less supplying then there will be less supplying of nutrients to the tissues, and as there is a less supply of nutrients to the tissues, then there will be less rate of metabolism and less rate of oxygen supply. So this will leads to less rate of metabolism and huge oxygen demand. It will, like, the tissue itself send some kind of signals where it makes the blood to increase the rate of blood flow. Okay, if there is less rate of metabolism and huge oxygen demand, then there will be automatically increase of the blood to the respective tissue which is in demand of high oxygen and in high demand of nutrient. So if there is an increase in both of these things, then automatically we can say that this is a kind of sympathetic stimulation. Okay, so this is the part of the thing which is bit complicated, I would say, but it is bit easy if you manipulate it soon. Okay, then the next point which comes is the innervation of the large vessels, particularly the veins, which makes it possible for sympathetic stimulation on to the decrease the volume of these vessels. Like if you would say the large vessels, usually veins are the large, usually veins has got a large area where it can take the carry, where it can carries the blood to the heart, and where it can helps in oxygenation of the blood, what we call it as pulmonary circulation. Okay, so due to that it has got a huge area and thick wall in its wall. Okay, so due to that, if there is an innervation of the sympathetic nervous system into the large vessel, it makes some kind of ease to the veins by decreasing the volume of the vessel. Okay, like as it has got veins have got a large volume, so the sympathetic system makes sure that it can decrease the volume by stimulating the sympathetic system. Okay, so this is the part of our discussion. Okay, so coming up to the next point, partial constriction of the blood vessel is normally caused by sympathetic vasoconstrictor tone. Vasoconstrictor tone. So what does it mean? Partial constriction of blood vessels is normally caused by vasoconstrictor tone. So what do you mean by sympathetic vasoconstrictor tone? So under the normal conditions, the brain signals continuously to the sympathetic vasoconstrictor nerve. As you are all aware, the two parts of controlling of blood innervation of blood vessels. One is the vasoconstrictor and another thing is vasodilator. If there is any constriction seen in the blood vessel, then there is an increase in blood flow. But if you see, but if there is any dilatation in the blood vessel, it is like it decreases the blood flow. Okay. So I would like to explain one extra thing. What if there is an excessive dilatation of the artery wall? There is an excessive dilatation of the wall of blood vessel. What do you call, how do you name the condition if there is excessive dilatation of the wall of blood vessel? So we usually call it as aneurysm. So you might have heard about the aneurysm. Like aneurysm is in the sense, like if you take an artery or a vein, if you take, I am taking any blood vessel, if there is excessive dilatation in the walls of the blood vessel, or if there is any balloon kind of formation in the blood vessel, we call this condition as aneurysm. So which artery of our body is more prone to aneurysm? So the artery is popliteal artery. Popliteal artery, which you might be knowing, popliteal artery, which is present in our thigh. the popliteal fossa which is present in our thigh. You might have studied about this in an anatomy. So the popliteal artery is more prone to aneurysm. I'm sorry for the spelling mistake, so let me correct it now. Okay, so this was the thing which I wanted to explain to you guys. So now coming up to the main topic. So if the under the normal conditions, the brain signals continuously to the sympathetic vasoconstrictor nerves fibers over the body, causing slow firing of these fibers at a rate of about 1.5 to 2 impulses per second. Means, so let me write it down the point over here. Under normal conditions, the brain continuously sends signals. I'm sorry for the spelling mistake. Signals to the sympathetic vasoconstrictor nerves. As you are all aware of the fact that there are two kinds of nerves. One is vasoconstrictor nerves and another one is vasodilator nerves. So vasoconstrictor nerves are responsible for constriction of the blood vessel, which helps in increase of the blood flow. And if there is the another kind of nerve, what we call it as vasodilator nerve, it usually dilates the blood vessel where it decreases the blood flow. So as you might have learned it in the pharmacology, like the patients who are suffering from hypertension, they are usually given with the drugs which acts as which activates the vasodilator nerve. So the drugs, what we call it as vasodilators. Okay, so the sympathetic vasoconstrictor nerves over the body causing slow firing of these fibers at a rate of about 1/2 or even 2 impulses per second. So if we let me explain this point a bit because it is a bit manipulative. Consider if a patient is if there is a person who has got a normal level of blood pressure and he has got a normal blood flow, what we call it a streamline flow. So if the person has got normal conditions, then the brain continuously sends signals to the sympathetic vasoconstrictor nerves over the body of the blood vessels. Means the body in the sense the walls of blood vessels, causing slow firing to the fibers at a rate of about 1/2 or over 2 impulses per second. Means, like, if you take a blood vessel which has got a normal blood flow, neither it is increase in blood pressure or decrease in blood pressure. So if there is a case of high blood pressure, then what happens is the sympathetic vasoconstrictor nerves causes firing of these fibers more than 1.5 or 2 seconds. Means, like, usually the normal firing of the impulses where it lets the blood flow in a normal way is about 1 or 2 impulses per second. But if there is any increase in impulses seen per second, then we call it as a case of hypertension. Okay, so this phenomenon, what we call it as sympathetic vasoconstrictor tone. Okay, so this is bit I could say a bit manipulative topic, I would say. So better like you just need not to cram this point. You can remember like this: if there is a firing of impulses more than 1.5 or 2 seconds to the blood vessel, then you consider it as hypertension, means increase in blood flow. But if there is firing of the impulses less than 1.5 or 2 impulses, then you can call it as decrease in blood pressure, what you call it as hypotension. Okay, it is totally based on the based on the concept hypertension and hypotension. Okay, so this phenomenon we name it as sympathetic vasoconstrictor tone. So now coming up to the next point, sympathetic stimulation increases heart rate and contractility. So let me write it down over here. Sympathetic stimulation increases heart rate and contractility. So the I don't think I need not to explain more about this, because the sentence itself says that sympathetic stimulation increases heart rate and contractility. In the sense, if, as we are known with the fact that sympathetic system is responsible for increasing each and every aspect of our body, and parasympathetic stimulation is responsible for decreasing each and every aspect of our body. So if as I said, the sympathetic stimulation increases heart rate and contractility, and if there is increase in contractility, then there will be increase in blood volume, which may also lead to increase in stroke volume, and increase in pumping. Okay, so now coming up to the next point, usually the norepinephrine, as you are known that norepinephrine, I think you might have studied about this in biochemistry. It is a methylated form of epinephrine. Okay, so we can say that norepinephrine is the sympathetic stimulation, sympathetic vasoconstrictor neurotransmitter. So how do we say that norepinephrine is the sympathetic vasoconstrictor neurotransmitter? As we have discussed in the previous lecture, the sympathetic and parasympathetic are both differentiated by the kind of neurotransmitter which is usually present in both the nervous system. So if you take about sympathetic nervous system, the preganglionic part has got acetylcholine as a neurotransmitter, but the postganglionic part has got either noradrenaline or adrenaline or epinephrine or norepinephrine. But the parasympathetic system has got only one kind of neurotransmitter in both preganglionic and postganglionic part, which is acetylcholine. Okay, so if we define the norepinephrine as sympathetic vasoconstrictor neurotransmitter. Usually, norepinephrine, if a patient, let me explain you in a clinical manner. If you have got a patient who has got hypotension, severe kind of hypotension, so what would be the immediate action would you take to in order to increase the blood pressure? So you administer the patient, let me write it down over here. The patient is immediately administered with 5 mg of epinephrine. Usually the dosage changes with like according to the patient's age and his agility. So it is the patient is immediately administered with 5 mg of epinephrine or norepinephrine. So what if we administer with 5 mg of epinephrine or norepinephrine with to the patient who has got a case of hypotension? What happens is it acts as a sympathetic vasoconstrictor, as you are known with the fact that the sympathetic means it increases any aspect of our body, and the vasoconstrictor, as I have said, if there is a vasoconstrictor mechanism is nothing but increase in blood flow, and sympathetic system increases the blood pressure. So both sympathetic vasoconstrictor acts at the same time by increasing the blood volume and increase in blood pressure. So it will as I have said, the epinephrine takes the blood pressure to the normal level by increasing the blood volume and increasing the blood pressure. Okay, so where the epinephrine is secreted, where are this epinephrine is secreted? It is usually secreted at the endings of the nerve fibers. It is usually, let me write it down over here, it is usually secreted endings of nerve fibers. Okay, so I would like to explain you like how the epinephrine or non-epinephrine also increases the heart rate. Okay, so I would like to explain about that also. How does the I'm sorry. How does the epinephrine or norepinephrine, I'll abbreviate norepinephrine in the short form like NER, increases the heart rate. So what is the mechanism behind epinephrine which increases the heart rate? So usually heart has got a receptor called beta 1 adrenergic receptor. I think you might have studied about this kind of receptor. So usually there are two kinds of receptors which are present in our body. One is beta 1 adrenergic receptor, and the another one is muscarinic receptors. So usually beta 1 adrenergic receptors are innervated by sympathetic stimulation, usually the beta 1 adrenergic receptors are controlled by sympathetic stimulation, and the muscarinic receptors are usually controlled by parasympathetic stimulation. So let me get into the point that suppose if a person is injected with epinephrine, so as you are known with the fact that epinephrine is a sympathetic vasoconstrictor neurotransmitter. So now it is a bit easy to understand that if we inject the epinephrine to a person, the blood flows, it usually binds the beta 1 adrenergic receptor. As it is as beta 1 adrenergic receptor is controlled by sympathetic stimulation, then obviously the epinephrine, which is a sympathetic vasoconstrictor neurotransmitter, it gets bind to the beta 1 adrenergic receptor, which may leads to increasing heart rate. Okay, so this is how I would say this is a kind of beauty where like it the regulation of our heart rate is controlled. Okay, now coming up to the last one of the most interesting clinical case is emotional fainting. I have mentioned it about this in previous class, but I would like to explain you in detail about this topic, what we call it as emotional fainting, or we also call it as vasovagal syncope. Okay, so we can say that it is an interesting vasodilatory reaction occurs in people who experience intense emotional disturbance that causes fainting. Like suppose you take a person who has got who is suffering from depression or is bit emotionally attached with something. So if there is an kind of what you call it, if there is an incident taken place which may like affect the person who is suffering from emotional disorder or is under depression, so usually these people are more prone to emotional fainting. So how does this fainting occur in our occur in those people? Like what is the mechanism behind that? Like in this case, the muscle vasodilator system becomes activated, and at the same time the vagal cardioinhibitory center transmits strong signals to the heart to slow the heart rate. So let me write it down over here. I'll explain you the whole thing. In this case, the muscle dilatory system becomes activated, and at the same time the vagal cardioinhibitory center transmits strong signals to the heart to slow down the heart rate. Okay, so what do you mean by this? So let me explain you in briefly. So usually the muscle dilatory system, as I have said, there are two kinds of system which are present in the blood walls of blood vessel. One is the constrictor system and the dilatory system. So constrictor system is usually responsible for increase in blood pressure and increase in blood flow, and the dilatory system is responsible for decrease in blood volume and decrease in blood flow through the blood vessels. Okay, so what happens if there is a decrease in if there is an activation of dilatory system? So now we can understand that if there is an activation of muscle dilatory system, then immediately there will be decrease in blood pressure and decrease in blood volume, and at the same time the vagal cardioinhibitory center means, as you are known with the fact that the vagus nerve, which is the 10th cranial nerve, vagus nerve, the 10th cranial nerve, it is a parasympathetic nerve. You are known with the fact that it is a parasympathetic nerve. So the as I have said, the vagal cardioinhibitory center, which is present in the medulla of our brain, it transmits the strong signals to the heart to slow down the heart rate. So as I have said, the parasympathetic system is nothing but to decrease any aspect in our body. So as I have said, there are two kinds of aspects which comes under here. One is cardio-acceleratory system and cardio-inhibitory center. Both the centers, the accelerator center and cardio-inhibitory center, which are present in our medulla. So a cardio-accelerator system is responsible for increase in heart rate and increase in the blood vessel, increase in blood pressure and blood volume, which is nothing but it activates the constrictor system of the muscles of the wall of blood vessel. Okay, but in cardio-inhibitory center, it slows down the heart rate, because as you are known with the fact it is a parasympathetic. It is under control of parasympathetic nervous system. So it decreases the heart rate and slows down. It decreases the heart rate, where the stroke volume also decreases. Okay, and if there is decrease in as there is a decrease in stroke volume, there will be decrease in cardiac output, decrease in cardiac output. Okay, if there is a decrease in cardiac output, then there is decrease in blood flow to each and every part of our body, which also includes brain, So as you are known that if there is decrease in blood flow to the brain, then obviously the patient will suffer from fainting, as there is a lack of oxygen in the brain. So this defines that there will be continuous episodes of fainting in the person or a patient, or patients who are under depression, or who are suffering from emotional disorders. Like if there is a like shocking incident taken place, and which affects them emotionally, so they are more prone to this emotional fainting, or what you call it as vasovagal syncope. Okay, so I would like to thank you all for your attention, and these were the things which were to be discussed. So there are many more things which are yet to be discussed. I will be discussing in the upcoming videos. So I would like to thank you all for your attention.